Hi, I'm Sandra. I'm one of the RTs here at Chula Vista. I'm going to talk about identification of potential skin breakdown. So one of the things we do when we're initiating BiPAP is that we're going to look at the high risk of the patient. So what is the high risk? One of the first thing is we're going to see if a patient has multi-organ failure. Another high risk would be if a patient is malnourished. Is the patient on chemotherapy? Is the patient confused? Or does the patient have other pressure ulcers on any other areas of the body? So before we start the BiPAP, we're going to inspect the skin. So we're going to look at the skin itself. We're going to look especially in the nose area and the nasal bridge to make sure, like if they're in the ER, if they come in from the field and they're prior on CPAP, they might have some redness already here and here. So if there is, we're going to notify the nurse and document. If we're accepting this patient from a transfer, we're going to be looking behind the ears, here, across the ears, behind the neck, on the forehead, on the chin, in the cheek areas. And this applies to bilateral. We would like you all over. If we have any findings, of course, notify the staff, document, and carry on. Okay, so we've already inspected the skin and we're ready to choose the skin barrier. So the first, if there's no redness to the skin, if all the skin is blanchable, the first step is to use Mepilex. So this is the Mepilex Light. It comes in a little square box. You fold it, you cut it, and it becomes a triangle. It places over the nose bridge, just like this. Make sure you don't occlude the nares, and it adheres. Try not to get into the eyes. We can make it smaller if we need to. Now, if the patient needs to go on, stay on the BiPAP for longer than 6 hours, we're gonna move the patient over to the Gecko. So there's two sizes. There's a small and there's a large. Hi, now I'm gonna demonstrate the application of the Gecko. This is a small, so we go to the bridge of the nose with the oval size up, placing it over, and just apply it like this. Every 4 hours when we do a BiPAP check, we're going to be removing it, checking, making sure the skin is blanchable, and reapplying it. At any time that the skin becomes non-blanchable, then that becomes a stage 1 skin ulcer. Then we move to a total face mask to prevent any further damage to the skin. Now we're going to present the ET tube, the movement of the ET tube. So this is the Hollister, and so we're going to first of all always inspect the skin. When we place the Hollister, make sure of always that you're able to place 2 fingers on either side. You're going to be checking the skin, that there's no redness, especially under the ears here. There could be erosion. Always communicate with your nurse if you find something, and document. Every time we do oral care, we're going to be moving the tube either to the right, center, to the left. Good place to check for any ulcerations is on the lips, on the bridge of the nose, in this area is where a lot of the ulcers occur. Now remember, not all patients are going to be indicated to be using the Hollister. So those patients that do not have the Hollister or will not be using the Hollister, we're going to be taping them. So remember that we change the tape on these patients once a shift. Okay, so now we're going to talk about oxygen devices. So when patients are on oxygen devices for long term, they start irritating the skin. And this is an area where we have very little fat on our skin, and there'll be potential for skin breakdown. We can also notice that there'll be redness developing here and on the chin. So if you apply Mepilex as a border, this is a way to protect the skin. So you cut it just the way you would the BiPAP. If we notice there's redness here or there's redness here, you're more than welcome to cut more Mepilex Light, and apply it here. This also applies to the BiPAP. Just as long as it's still blanchable, it's still okay to use a Mepilex. Okay? When on the BiPAP, only once it becomes non-blanchable do we advance to the total face mask. But staying to the oxygen devices, if you see redness, you're going to apply Mepilex to protect the patient. Next, we're going to talk about protecting this behind the ears with patients that are on nasal cannula. This also applies to the mask, to the elastic string of the mask. You'll find these on the cards. They're easy wraps. They're non-adhesive though, so it's a challenge to get them to stick on the patient, but they still protect just as well. Another thing nurses are doing is that they're wrapping these areas with Mepilex. So if patients have a potential area for skin breakdown, you can apply Mepilex just like this. Remember, the goal is to do less harm to the patient as we can. Thank you. And to finalize this BiPAP presentation, just want to remind you all our documentation requirements. So every 4 hours when we do our BiPAP inspection, we're going to be documenting the skin assessment, what we found. We're going to be documenting the barrier devices that we're using, and then the action plan that we took. For example, we had the Mepilex, and then we graduated to the gecko. You would say graduated to gecko. If the same continuous care continues, you would say usual care will continue. Thank you.